Hi, I am Ajit Virkud, Professor of Obstetrics and Gynecology from Mumbai.
Hello, citizens of the internet. Today I am going to discuss another important drug used in obstetrics, methergine. Methergine is an ecbolic that is a uterotonic drug. It is available as an amber colored ampule containing 0.2 mg of methyl ergometrine maleate, that is a semi-synthetic derivative of ergot alkaloids. I'll first talk about the mechanism of action. In large doses, it causes powerful, sustained tetanic contractions of both upper and lower uterine segments. It should be noted, however, that in very small doses, ergot preparations can evoke rhythmic contractions and relaxation of uterus. It also causes intense vasoconstriction that may lead to hypertension. This table tells the difference in the uterotonic action of oxytocin and methergine. Oxytocin causes episodic, dose-dependent, mild to moderate contractions of only the upper segment and retraction of the lower segment. As opposed to this, methergine contracts the upper as well as the lower uterine segment. Methergine-induced contractions are powerful, sustained, and tetanic. In other words, oxytocin causes physiological contractions of the uterus, whereas methergine causes pathological contractions of the uterus. When ergot alkaloids are used, there is a loss of polarity during uterotonic action, whereas with oxytocin, polarity of myometrial contractions is maintained. A clinical pearl: ergot alkaloids should never be given before delivery of the baby. The earliest they can be given in labor is after delivery of the anterior shoulder in a singleton pregnancy. Methergine, also called as Utergine or Lerine, is available as amber colored ampules containing 0.2 mg of methyl ergometrine maleate per ml or 0.5 mg of ergometrine maleate per ml. Methergine tablets containing 0.2 mg methergine are also available for oral use. Methyl ergonovine is another preparation available. It is more selective than other ergot alkaloids, that is, it acts only on the uterus. Unlike oxytocin, which cannot be given orally, methergine can be given orally, intramuscularly, or intravenously. When given intramuscularly, action starts within 4 to 7 minutes, and given intravenously, onset of action is within 40 seconds, and when given orally, it takes 10 minutes for action to start. The table shows onset of action for ergometrine and methergine. Methergine is metabolized by the liver. Plasma half-life of methergine is about 2 hours and its action lasts for 3 hours. Methergine is contraindicated before birth of shoulders, before second twin is born, heart disease in pregnancy, gestational hypertension or chronic hypertension, Rh negative patient, lactating mother because it interferes with lactation, vascular disease such as coronary artery disease, Raynaud's or Berger's disease, and known hypersensitivity to methyl ergometrine or to other ergot alkaloids or any other excipients of methergine. Uses of methergine in obstetrics are prophylaxis and treatment of atonic postpartum hemorrhage, where 0.2 mg intramuscularly or 0.1 mg intravenously is given after delivery of placenta. It can be repeated every 2 to 4 hours for maximum of 5 doses. To cut short third stage of labor, 0.2 mg intramuscularly or 0.1 mg intravenously is given after birth of anterior shoulder, the so-called active management of third stage of labor. Treatment of subinvolution, lochiometra or puerperal bleeding. The recommended dose is 1 to 2 tablets orally up to 3 times daily for 5 days, following cesarean delivery or hysterectomy to facilitate uterine contraction. Side effects seen with methadone are nausea, vomiting, transient hypertension if given intravenously, tinnitus, chest pain due to acute coronary spasm, and rarely peripheral vasoconstriction leading to gangrene, for example, of toes or bowel, and convulsions. For further reading on this topic and other topics in obstetrics and gynecology, refer to following books written by me. Practical Obstetrics and Gynecology, Modern Obstetrics, Modern Gynecology, Clinical Cases in Obstetrics, Questions and Answers, Clinical Cases in Gynecology, Questions and Answers, and Pelvic Reconstructive Surgery. If you have found this video useful and informative, please subscribe to my YouTube channel by clicking here.